Hello, I'm Mark Leonderis. I'm the medical director and founder of Reproductive Medicine Associates of Connecticut and Gay Parents to Be. And combined, those two entities really serve the LGBTQ community. And I have a personal interest and focus because as a dad through egg donation and surrogacy, I felt like I wanted to offer a high-class New York City area practice that's able to maintain high success rates and serve our community. So why choose Gay Parents to Be? So our third-party team is, for a practice our size, includes 5 nurses, 5 admin people, 2 licensed clinical social workers, a genetic counselor, plus the other 100+ employees that work for the practice. And a lot of practices outsource their mental health. They'll outsource their genetic counselors. I've kind of brought all these people in under one house so we can all talk to each other easily and kind of work towards your case. As far as for people who live in New York, we're an hour outside of New York City. You can either drive or take the train to South Norwalk. I'm a big proponent of understanding what your sperm counts are before we get started. So one of the things we'll do up front at any local fertility center in New York, because you can throw a softball and hit one, is we'll check your sperm count. But then we'll bring you in for what we call a team day. And that team day is my desire to basically get as much as I can done in a 4-hour appointment. So you'll meet with me, we'll freeze your sperm, we'll talk about donor screening, and you'll meet with a social worker and so on. And then from that point in time, once we have your sperm cryopreserved, we can move forward and look for a donor. One of the things that I like about having a clinic that's local to you is I think it's really important that you meet your gestational carrier. So, I've had 2 gestational carriers with 2 different surrogacy agencies, and one of the things I'm more than willing to share is kind of what happened to us and our personal experience and so on. But your gestational carrier, meeting that person in person versus via Skype, I think is really important. So I think that's something that's a real advantage. And then, the culmination of now you're starting here, but by the time you get to embryo transfer, it's going to be somewhere about a year to maybe 2 years later, but it's that special day of an embryo transfer. And to be able to come to that and be in the OR with your surrogate and so on is actually quite amazing. We have about 50 pre-screened donors that are ready to match. That means they've gone through the screening process. You may or may not be aware that only about 5 to 7% of young women who applied to the donor pool actually get accepted, and that's across the board at pretty much all the centers. So we follow American Society for Reproductive Medicine guidelines and FDA guidelines. And we've worked really hard to take our donor program from an anonymous program to a known program because I thought it was important to our community. So 90% of our donors are willing to be known. They're willing to meet you. If you don't want to do a formal, exchange contact information, we can just do a meet and greet over Zoom or Skype. If you want to do a formal known relationship, we'll have your surrogacy agency or an attorney we recommend do a formal legal agreement, which costs you about $1,000, but that's kind of up to you. We have an easy-to-use database, and using an in-house donor pool saves you kind of about somewhere around $10,000 to $15,000. Just because if you go out to agency, faster. If you go out to agency, you have to pay an agency fee, and you have to pay the same donor comp, and you also have to pay travel. For me, we offer 2 embryo transfer package and an unlimited transfer guarantee plan. So I've tried to build this out because what I found in my experience is I always felt like we were being asked to pay more. So we've tried to make it so there's basically what you're spending. Next slide. So kind of some of our numbers over the past 2 years, our practice has completed almost 300 transfers into gestational carriers. Our first cycle success rate at our practice is 78%, and I just calculated that for our last 100 patients. That means the majority of our patients are pregnant after only 2 attempts or transferred. And right now, 100% of people that have started have had babies as far as used all their embryos and so on. So, I'm committed to making this work for you. I mean, I'm a dad through this process, and it's a different process than regular infertile couples go through. Next slide. So kind of a little bit more about me. So obviously, I'm gay, I have a husband. I'm also now the chair of the LGBTQ Special Interest Group for the American Society of Reproductive Medicine, so I put some of my time there. I'm an international speaker for LGBTQ insurance advocacy, and I'll gladly kind of give you what I know for advice and try to point you in the right direction so you can access your benefits. And we're, like I said, one of 2 practices that is an HRC, healthcare equality leader, so we're fully vetted as far as being able to serve our population. Next slide. So these are my two little monkeys. They're a little bit bigger now, but your life is going to dramatically change in a good way. And if you want to take a vacation, take it now, because then it's a family trip from there on. So next slide. So basically, our team is pretty active locally, and it's a great group of people. So next slide. So I'm proud to help you build the family of your dreams. There's a lot of good providers here. There's a lot of good surrogacy agencies here, and I think you just need to find someplace that works for you and a doctor that you can have a relationship with, because my job is to navigate the hoops and the hurdles. The rest of this should be pretty straightforward. Is there a last slide or not? Is that it? All right. Does anybody have any questions? And as far as process, I've had a few questions here, so we'll talk about that. You can easily make embryos and freeze embryos and get that financial expense done, and then come back a year or even 2 years later when you need the bigger bucket of dollars to move forward with a surrogacy journey. So you don't have to do this all at the same time. I know that some people start with the surrogacy agency and then get directed to the clinic, and that's fine. That is a more expensive pathway than starting with the clinic, picking your donor, freezing your embryos, and then when you're ready and you're financially fit enough to sign with the surrogacy agency. So that's something that I kind of think is worthwhile. The other part of the story is that you need to know how many embryos you have and that everything went well before you even need a surrogate. So it makes a little bit more sense to take that step first. As far as we regularly do sister donor to brother, gay brother cycles, and we also regularly work with familial or friend-related gestational carriers. We do require some legal and agency support for that, because that can be more important. But that's another way people can work to cut costs and things like that, and it's also can be quite beautiful.
Briefly brought up that it sounds like your suggestion is to start with the egg process and then go down the surrogacy route. I presume that requires the eggs to be frozen.
The embryos to be frozen, yeah.
Frozen. Is there any success rate difference in doing it that way?
So the chance of harming an embryo with embryo cryopreservation is about 2 to 3%. So, but what we would want for any intended father is for you to have more embryos than you ever need. So the other part of the story is I haven't done a fresh embryo transfer into a gestational carrier for years upon years. And if you poll the doctors here, none of us do it. We all cryopreserve. So it's pretty much frozen either way. And if you want to have the ability to do embryo testing, you're going to freeze your embryos no matter what. The other question is frozen eggs. That was not your question, right? All right. Yes, sir.
You had mentioned that you think being local with the gestational carrier is important. That you have.
No, what I said, it's nice to be local, to meet with your gestational carrier in person and to be able to come for the embryo transfer. Our gestational carrier lived in Denver, another one lived in Pennsylvania. Your gestational carrier is probably not going to be local. If the surrogacy law passes, you'll have a lot more potential New York surrogates around. But the other reality is you're going to see your surrogate about 5 times through her journey. You're going to see her for a transfer, first trimester ultrasound, second trimester ultrasound. You're going to visit her at 28 to 32 weeks to register the hospital and buy your baby stuff, and then you're going to go to the delivery. So wherever she lives, that's not that important, but you are going to talk to her every week and build a relationship. The bedrock of a good surrogacy journey is trust, so you need to build that trust. Yes, sir.
Just to follow up on the tail end of that, so can you just talk about if there's any differences between frozen versus not frozen eggs?
There is a difference between frozen versus not frozen eggs. There's probably about a 10 to 15%, I moved again, sorry. There's probably about a 10 to 15% decrement in outcomes for frozen eggs. Now, the other part of the story is when you work with a frozen egg bank, you typically get 7 or 6 to 8 eggs. And there's a significant attrition rate from thawing the egg to the egg fertilizing to that fertilized embryo making a blastocyst. So ideally, if I have a single intended parent cycle, I want to get about 15 eggs. If I have a 2 intended father cycle, I want to get more than 20 eggs. So I can navigate that decrement as we go through the norm, and that's a normal process for mammals. So that being said, if there is a significant cost savings to get only 6 to 8 eggs, but certainly it's your chances for having more embryos, excess embryos, and if you have any gender preference to have embryos of the desired gender, if that's important to you, are going to be better served if you do a fresh donor cycle and get more eggs. Yeah.
You alluded to the fact that starting with a fertility clinic and developing the embryos ahead of signing with an agency may be more cost efficient. Can you expand on that?
It's not necessarily it's more cost efficient, but you don't need all the money at the same time. So if you sign with a surrogacy agency, let's say they have a $20,000 sign-on cost, right? You need that money up front, right? They're going to be looking for your surrogate, but then when you come to the IVF clinic, we all kind of work off a fee for service, right? So your IVF costs, let's say donor, everything included, are going to be another $40,000. You needed $60,000 right there to get going, right? And then once your surrogate comes through, you have to load the rest of her escrow. So basically in 18 months, you're going to need your whole bucket, whole cart. If you make your embryos first and freeze your embryos, you can decide when you can afford the surrogacy aspect of the journey. Does that make sense? Yeah. Anything else question-wise? Yes.
What's the reason you want to do a sperm count as your first?
I'll tell you exactly why, because I had a couple come over from Denmark, and we assumed everything was going to be fine, and one of them had no sperm. And they weren't a rich couple, and it was a big deal for them to come to freeze their sperm. And then I would say about 10 to 15% of the time, somebody has a lower sperm count. Sometimes I'll put them on vitamins and supplementations. About 2% of the time, I'm sending people to urologists because they meet criteria for severe male factor infertility, and we're doing more of a workup. I don't like surprises. I kind of joke and say, you want your doctor to be neurotic? I'm neurotic, so I'm very process oriented. I just want to check my boxes and get through it. So I think if you both want to be intended fathers, it's important for you guys to know that you both have normal sperm counts, right? And if one has a potential problem, can we fix it? Now, we regularly treat infertile couples and men with severe male factor infertility, and we have successes with that. But this is a one time in your life that you have to create these embryos. So at that one time, you want to change your lifestyle choices, if any of them are bad, and make sure if you optimize your sperm count, because these are the embryos that are going to make your family, right? You don't have lots of chances to do this. Any other questions? Yes.
Do you have any clinic in Florida?
Excuse me? Do we have a clinic in Florida? No. So as far as so gay parents to be is kind of international at this point in time. So typically, if I have somebody who lives far away, they might only come to the office once. If you live in Florida, you'll probably come for your team day, and then you'll probably come for your surrogate screening day. You might not come for your embryo transfer. It'll be up to you. As far as I have there's only about 1,500 reproductive endocrinologists in the whole country. So can you do your semen analysis in Florida? Yes, we can get that done there and get things started. My typical pathway is I do virtual consults, and I do some Saturdays here in New York, and then those are followed up with a team day visit. So if you live in Florida, we can easily do that. Yeah. 1 minute. 1 minute. So I want you all to be bold and excited, and it's great to be a parent, and this works. It is expensive. It does take about 2 years, but it's pretty amazing. And so good luck and congratulations for taking this step and being here.